Welcome back to Rural Health Today and our latest series, Rural Health Fractured. This series, we're discussing how rural health is being fractured in nearly every direction by the politicization of health and science, the decline of resources for rural communities, deterioration of adequate insurance coverage, and so much more. As we take a closer look at the fault lines in our healthcare system, our guests will provide new perspectives on how healthcare leaders can navigate these challenges and explore sustainable solutions. Now, I'm in the studio today, and I'm absolutely thrilled and overjoyed to have a very special guest with us. In fact, someone representing an organization that we have never on this podcast spoken with before. So I'm excited that this is our first opportunity. It's great to have in this studio Alana Skye Campbell, and she is the Senior Director of Healthcare Access at the National Multiple Sclerosis Society. And we have never had the privilege of anyone from your organization on this podcast, but it is such an important topic that we can't neglect it, and we must really address some of the issues that we're facing in this area. And so it's great to have you here for your first podcast on Rural Health Today. So thank you so much for joining us. And if you could just give us a little bit of information about your role at the National Society and how long have you been there, what brought you to the organization, and ultimately, why'd you choose this field?
Yeah, thank you. Thank you so much, JJ, for having me here today. And especially on behalf of the society, we have so much appreciation for the opportunity to highlight the critical issues facing rural health, and particularly through that lens of individuals living with multiple sclerosis. So I started at this society about a year and a half ago.
Okay.
And my role is really centered around initiatives that aim to improve access to care for people living with MS, particularly in medically under-resourced and rural communities. And it's all about making sure people in those communities can access the care that they need. And I always say, if there's one deeply held belief that I have, it's just that everyone should have the opportunity to attain their highest level of health. So I've always been involved in some area of work revolving around that deeply held belief. And the society, their mission, it's to empower people affected by MS to live their best lives. And I came to the society because I wanted to be a part of a team that was really working to remove those barriers and create opportunities for better access to quality care. And my interest in patient advocacy, it actually really stems from my clinical experience. I have a registered nurse background.
Oh, wow.
Yeah. And my first exposure to working in healthcare, because funny enough, I used to say, I'm never, ever working in healthcare. Well, we see how things evolve. I was trying to figure out, okay, is this something I want to do? Am I interested in moving into nursing? And one of my first experiences working in healthcare was working as a nurse assistant on a med-surg unit in a 25-bed critical access hospital in rural Vermont. And that's really where I found I affirmed my interest in nursing and went on to get my bachelor's of nursing degree, my nursing license. When you're in nursing school, everyone is, I want to go to the ICU. I want to go to the emergency room.
I want to be a flight nurse.
Yes. And, I felt there were a couple of us, but I was often the outlier, which was I wanted to do community health nursing.
Yeah.
And I went into my nursing degree knowing I wanted to do that. And I came out immediately working in community-based support and stabilization services. I was working with adolescent youth. I went on to work at a federally qualified health center in family medicine. So I always wanted to do that primary care, preventative, earlier intervention work as a nurse. And I think what happens is you spend enough time working, in the clinic setting, and you start to see these flaws. You start questioning, well, why are they the way they are? And I really felt compelled to really understand that public health perspective. I was working with patients that were very sick. They were facing barriers to care, stigma, and I wanted to dive into understanding how are we protecting the health and safety and well-being, that well-being piece of communities and populations. So I went back to school. I got my master's of science in nursing and population and public health.
Nice.
And I was thinking about the title of this podcast, which, rural health fractured. It's a discouraging moment to be working in public health and population health. And I had a mentor, Joanne Costello, in my graduate program, and she just, she said things might get hard, but she instilled in me this really constant sense of like positivity and the belief that nurses can affect change, and that even if it's super incremental, the work that you're doing matters. And so I feel like through all the, the challenges, I've kind of tried to maintain that mindset that Joanne instilled in me, because I think we know, right, there's dissolution of infrastructure. I mean, we're seeing closures. There's so many challenges
there
now.
There is.
Yeah. So that's kind of how I got to be here at the society, kind of a evolving journey, but
full evolution. And we're going to dive into some of the things that you mentioned in your intro about the impact on rural in some of those specific concerns that you brought forward. And we're going to dive into that in just a minute in the body of our podcast today. But one of the things that we like to do is we like to humanize our guest, because we have listeners across the country, across the world. I mean, several of our friends in Ghana tune into this, and we have folks that are listening who may not know, you as an individual. And so it's always good to humanize that. Like, you're not just, this scholarly RN. So one of the things that we ask is a little bit, personal, an interesting fact about yourself. Now, we've heard it all. Everything from, I've run marathons to I fell down a mountain, you name it. But I want the listeners to get to know you as a person a little bit better. So what's a fun fact about Alana?
Yeah. So prior to becoming a nurse, I actually worked in sustainable agriculture for many years. So I was growing food and raising animals for meat and dairy.
Nice.
And I initially I was working on production scale. So acres and acres of onions, weeding acres and acres of cabbage. It really started at that scale of growing food on a production level. And then I found through that work that it was really a very therapeutic and reverent practice for me. Mm-hmm. So I started thinking, how do I bridge this and start working with people? And I moved on to doing farm education. So I worked with school-age kids where they got to come and work on the farm and do things like barn chores and forestry. We would have them doing, during sugaring season, they get to come out and collect the sap. So I transitioned into doing plant-based work with people. And I also worked on a memory care unit with people living with Alzheimer's and dementia, doing horticultural therapy.
Wow.
So I'm no longer living and working on a farm, but I love plants. I keep a large garden, even though I live in the city, and I will say it's a constant fight with the squirrels.
Oh, I could only imagine.
They eat my cherry tomatoes. Eat my sunflowers.
We know what that's like. We have a family garden, and it is practically like a quarter of an acre of everything from corn but every year I have to go out to the in-laws, and we spend a day getting it ready to safeguard it from all the animals, because we have deer and we have squirrels and all of that stuff. But there's something just therapeutic as well as just sustainability when you go out and just pick yourself some tomatoes and some corn, and then the ability of any overflow to contribute that back to your community that may be in need. It's really a great feeling. And so it's great to know that you're one of us, in the country rural side that have a farm and that have a garden and that, creating sustainability. So that's a great interesting fact about yourself. So interwoven into your job today, obviously you're cultivating quite a bit. You're planting a lot of seeds and you're working very hard. And I want to get into that today because we have heard this phraseology of healthcare deserts, right? And we've heard it in the context of other programs like maternity deserts and deserts of care. And, what we're talking about today is also deserts in rural America, of how access to local healthcare impacts the diagnosis and treatment of specific medical conditions because there's a lack of access to primary care or to specialty care, or there is no OB at all except for 100 miles away. And so I'm excited that you're here today to share your perspective and insight on healthcare access for multiple sclerosis care and treatment. And we'll talk about barriers to receiving care in treatment in a healthcare desert and the impact of limited access on the well-being of a community, and of course, what all of this has to do with rural health in America. So I want to jump right into the heart of some of these issues, and let's just start with the basic question: how and why does a community develop into a healthcare desert in general, and why are rural communities, which is a large landmass of our country, uniquely susceptible to this? Can you give us a little bit of background about that?
Sure. Yeah. And this is it's complicated.
It
there's multiple factors that contribute to a community developing into a healthcare desert. And I do think we have to try to look at that whole picture. The first thing that comes to mind is we know that geographic isolation piece. By nature of where they are, rural areas are often farther from medical facilities, and that makes it difficult to access care. We know there's limited public transportation, so there may not be a bus line or a rail line to get to the care that you need. And we see this through the society's work is people are more likely to have to travel long distances to access those services. And we see this with MS specialists in our work. We also know limited economic resources, so rural communities face higher rates of poverty and unemployment, and with a lower income level, that's fewer financial resources to access healthcare. Yeah. We know that when one's looking at their monthly finances and they're saying, okay, am I going to pay rent this month, buy groceries and put food on my table, or am I going to go get that blood pressure check or see my primary care or see my specialist? There's often more pressing needs. Yeah. And people may be postponing medical care because of those higher priority needs. They may. Shortages of medical professionals, recruiting and retention of healthcare providers in rural areas is challenging, and that can lead to those gaps. And I often think about when we're considering workforce development and thinking about these shortages of medical professionals, I do think we have to think about equitable access to education, and even at those earliest stages, such as grade school, because what do those pathways look like for students in rural areas into health professions? And transportation can be expensive. It can be logistically complex because students are more geographically dispersed, which may drive expenses away from educational initiatives and supplemental programs and learning experiences. And that may limit, in the long run, career pathways into health professions. And the society, we have been partnering with area health education centers, AHECs. That may be familiar, a group to you, JJ. But with them, we've been working with them because they're reaching pre-college level students. They create pathways for students that may not have otherwise seen or had opportunity to do so. So we've been working with AHECs to try to increase knowledge around MS, because that piece of recruiting and training and retaining those healthcare professionals is so important in rural areas. Yeah.
So in the context of rural health and looking at it from the lens of what we call social determinants of health, we know that those deserts that you've just described, all the barriers, whether it's transportation, income, all of those are barriers. So, Alana, let's talk a little bit about what you work in specifically every day. And that is the passionate work that you do around MS. education, awareness, treatment, those types of things. So let's just start with an understanding of MS in general. And, we know that there are many patients in rural communities and urban, but we're focusing on rural. The question of, do patients living with MS and other chronic illnesses in rural communities experience additional barriers to receiving care and treatment? And, I guess, I think I know what that answer is going to be, I would assume. But then what has the society's research, on the neurological and multiple sclerosis deserts uncovered?
Yeah. So I think before launching into the research, it's important to understand what MS is and how it presents. So MS is a chronic immune-mediated disease of the central nervous system. So it affects the brain, the spinal cord, optic nerves. And multiple sclerosis literally means many scars. So that's the lesions that accumulate in the brain and the spinal cord. And so it disrupts the communication from the brain with the rest of the body. And what happens is, depending on where those lesions are, people can experience a wide range of symptoms. So it could be vision changes, mobility changes, fatigue. It's an unpredictable disease, and it's lifelong. Mm-hmm. And there's no single test for MS. So it's a diagnosis. The diagnosis is a process. It relies on neuro exams, MRIs, ruling out other conditions. But what we know from decades of research is early diagnosis and early treatment does lead to better health outcomes.
Yes.
Yeah. So we have seen a lot of progress around our disease-modifying therapies, and we know that ongoing specialty care, it significantly slows progression. When we're thinking about MS, time matters, and geography often determines time. So part of our work, we know the sooner the diagnosis, the better the outcome. And we want to build urgency around that messaging, but we recognize in rural areas, there's barriers to receiving that care and treatment. So there's simply not enough MS specialists and neurologists in rural areas, in these desert areas, to make that diagnosis and provide that specialized care. Yeah. We have our desert map. So that desert map, JJ, it is an interactive dashboard. What we did was, with Deloitte, we mapped out access to neurologists and MS specialists across the U.S. down to the county level, where we can see, okay, based on what county you're in, do you have limited access, full access, partial access to a neurologist or an MS specialist? And what that dashboard shows is that only 13% of those in rural counties have full access to neurological care.
Wow, that is incredible.
Yeah. And then we also know 83% of people living in rural counties reside in MS specialist deserts. So we look at both neurologists and then the subspecialists too, those MS specialists. So we see that people in rural areas are disproportionately impacted by that access issue.
Definitely challenged. And we find that regardless of the modality or the service line or whatever the ailment is that the diagnosis that comes in for a cancer patient, for example, and lack of transportation to get to a cancer center limits their ability to seek treatment, maybe even in a timely manner. And those become very important issues. In your area of MS, advancements in treatment, diagnosis, where do you find that today? I mean, do you feel there's some good breakthroughs? Do you feel like it's still a huge barrier, that you're still trying to fight this? And then on another level, we've got a lot of challenges at the federal level about how we're funded in research and development. I do want to focus a little bit on that if we could, because the work that you do is also looking at, you have to do research and you have to have, funding to be able to do specific research. And a lot of that research and funding right now for that research is in limbo. The federal government is making other priorities with healthcare research, cutting universities and other things. So where does that all fit into what you would define as any advancements in, the field of MS?
Yeah, I mean, I do think, right, it used to be when you received the diagnosis, there were very few options for people receiving the diagnosis.
Right.
It was, go home, get your affairs in order. This
exactly
is a progressive neurological disease, and we can't tell you what's going to come next, but it's not going to look good. And we just know now with the disease-modifying therapies, people live long, happy, healthy lives. That being said, our goal at the society is to find a cure. That's the aim. We really, we invest in research. Our goal is the cure for MS. And I always hear our CEO saying we're getting ever closer, in our lifetime. Hopefully we will have a cure. But I still think we have a ways to go yet, right? It's still evolving. But initially there were very few options for treatment. And now there's something over 20 options for MS treatment.
Yeah. And so just so I understand this and our listeners do, it can slow down the progress of the disease. Is that correct? Or what methodologies are we using to do that?
Yes. So once you have lesions, we can't go back and get rid of those lesions,
right.
But the treatments act by slowing progression. So slowing the demyelination of the nerves in the central nervous system. So it slows progression. And that's why, to get back to my earlier point around, earlier recognition is so important, because the sooner we can get that diagnosis, the sooner we can someone can have access to that treatment, the better, because it slows that progression.
Right. Yeah. And if you were to look at, education and look at it from the lens of what should providers in rural communities be doing? And I guess what could they do differently? What advice would you give them to care for patients living in the rural healthcare deserts as it relates to the topic that you know best, which is MS?
Yeah. So I like to say we need to get outside of our neurology box when we're talking about MS and the rural setting. I do think it's important. Every healthcare professional really can play an active role in supporting and providing care for people with MS, but also in decreasing that time to diagnosis. So some of our strategy has really been to engage all these different health professions types. So community health workers, primary care providers, rehab therapists, visiting nurses. We really see reaching all of these different health professions as a way of generating opportunity for earlier recognition, because we know in rural settings, the neurologist and the MS specialist is often way down the road. It's really often someone's presenting to their nearest rural health clinic or their FQHC, or they're going into their closest critical access hospital and they're presenting with those symptoms. So we really want to educate and engage those rural health providers and all those different professions types. And I think what we run into with MS is we're not as common as other conditions. We're not a rare disease. We're not categorized as a rare disease, but certainly we're not as common or prevalent as other conditions like hypertension or diabetes, heart disease. There's around 1 million people living with MS in the U.S. And I think sometimes MS, when we're talking to these different health profession types, it's like, well, what does MS have to do with me and the care I provide? And, we're trying to raise that awareness, encourage all these different audiences to think of MS, to consider it.
Yeah. What would you say to empower community members and community leaders who may be listening to this podcast? What can they do to raise awareness or to be part of the solution for the work that you're doing at the center? What do you need from the community? What do you need from your hospital community, but what do you need from the community in general?
Yeah, I think to become familiar with MS, I think a lot of
Yeah.
Folks are just not familiar with it. It to make it feel relevant to these different administrators and hospital systems and community health clinics, and because recognizing there's so few neurologists and MS specialists that it requires kind of an all hands on deck approach. It isn't something that within rural settings we can quickly refer to your neurologist, because we know those wait times are months, several months, 9 months, 12 months, depending where you are in the country. We hear about a significant delay in I don't know, JJ, and where you are.
We face it.
Yeah. What do you see?
Yeah. I mean, you're
delays?
talking months and months to have access to specialty care.
Yeah.
And transportation in our community, much like most of rural America, lacks the ability to have a infrastructure that supports the ability for patients to be transported beyond maybe even a 4 or 5 mile radius within a small community. And so rarely do you have countywide transportation. You certainly don't have statewide transportation. So when you get these small hospitals that may refer more of these type of specialty disease, approaches to university hospitals or to tertiary centers that are 200 miles away. And so they can't get there. So the barrier to transportation is one aspect, but then the other aspect is they're filled and you wait for a very long time to get the appointment. And that is something that we're trying to raise the awareness, for med schools. And the harder the government makes it by not giving education loan reimbursement to physicians and not giving a stipend and forgiveness and consideration to those who go to rural communities, all that stuff is getting rolled back right now. That's a problem. We're going to find even greater amounts of care deserts in our rural communities than we've ever known possible as a result of some of these legislative actions that have taken place. So very, very concerning. We're not any different than our counterparts, maybe a state away that has the same, demographics, but it is something to be of great concern, which is why we always raise, the understanding that we have to get involved as citizens in educating our legislature and our elected officials about the importance of programs for physicians to get their training, as well as for research and other things. And so it's going to be a fight. It's a fight ahead of us right now in Congress. It's a fight ahead of us in states across this union. But I believe as we look at history judging us, we're on the right side of history, and we just continuously have to fight for that. So that becomes the challenge.
We need to create incentives for individuals to train as neurologists and then go practice in these rural areas.
In these rural communities, yeah.
As you were talking about that 200 miles, another thing from our dashboard, one of the areas that we're working right now is Wisconsin, and we know the average driving distance in miles. It's 205 miles to your nearest MS specialist. And it is not uncommon for us to be hearing people traveling 4 hours, 5 hours, 6 hours to get to their closest MS specialist. And then you think of that layered with having to manage a disease such as MS. That's like a tremendous emotional and physical burden.
It is.
For those that have to make that sort of trek to get the care that they need.
Yeah. We're going to, in the show notes, we're going to put, information about how individuals can contact you and your organization. I think that's important. I want to end our podcast, and it's hard to believe our time is already upon us, but I want to end the podcast with a couple things. First, what are you excited most about in the work that you're doing right now? But maybe it's the future. Maybe it's a project you're working on. Maybe it's just like something encouraging, because in this series of Fractured, we get a lot of bad news. We get a lot of forecasting of what the federal government's doing to us, what the respective states are doing to us. But what's exciting for you right now in the industry that you're in?
Yeah, I appreciate you saying that, JJ, because I was also thinking about, I feel like we hear about, and I spoke to this earlier, that geographic isolation piece, right? But we also know rural communities are
Yeah.
deeply connected to each other, deeply connected to place. So I think
Yeah.
we always have to keep both things in mind, right? Because there is a lot of stories of, oh, this is going away and
Absolutely.
whatnot, but
Yeah.
also there's much to celebrate. And I think in my experience speaking with clinicians practicing in rural areas, there's so much resilience and commitment and dedication and all these wonderful
There
things
is.
too.
There is.
But what I am excited
Yeah.
about the work is I think we are leading some great initiatives. I think of the work we're doing in Wisconsin with a group called the Wisconsin Collaborative for Healthcare Quality, where they're using clinical data from health systems within Wisconsin. It's this really great model where they have 27 health system members that have shared their clinical data with the idea that by sharing that data and having that understanding across health systems, we can really impact change and drive quality improvement initiatives for Wisconsinites. And we're currently mapping out diagnostic timelines across these different member systems.
That's
And
great.
then we're going to be putting together a
That's
digital
great.
toolkit, a summary report that we can share out across communities, health systems, policymakers, so we can say this is where there's opportunities for improvement, and these are some ideas we have around how we can address these barriers in rural areas. So I'm excited about that.
Yeah. Gardener by heart and builder really by profession, because you're building something pretty incredible. And it is looking at, something that we don't often focus on in rural hospitals because we're worried about general surgery and we're worried about the ER and the OB, but specific disease types. And then looking at MS and the work that you're doing with it, you're doing a tremendous amount. And I want to thank you for your contribution, which whatever you do there multiplies, to all communities across the country, because you're not just in a isolated little area in a bubble. You're producing, information out to the masses. And so continue to keep up the great work that you're doing. One of the things that we'll end with today is we always just really take the pulse and the temperature of leaders across the country. We know we're in tumultuous times, and we have a lot of new leaders that have stepped up into leadership roles during the pandemic and post-pandemic. And there's a lot of challenges: federal funding, negotiating with insurance companies, facing disease states that, we just don't have the resources to address. And the list goes on and on. But for each of our guests, we just like to ask them, what is your recommendation that you would give to someone who may be new into healthcare and who has that passion that Alana, I see you have, who may need to temper that at some level, but it can get very discouraging if we go 200 miles an hour and we're just always restrained by great fires. So it could be a tip for someone new in healthcare. It could be something that's a piece of sage advice that you would give on thriving in a rural setting. And we add these recommendations as a guide for our community, which is comprised of leaders across the country, to get on and to learn just a little bit more. Find it at ruralhealthtoday.com. Alana, what is your rural health recommendation for someone today?
Yeah, I would like to speak to rural health professionals, and I think about my experience as a nurse, and I think it's really important when we're working with patients that we meet them where they are and we listen to understand what may be getting in the way of them achieving their best health. And I really stand by this, that careful and close listening, that allows us to get at the root cause of what's getting in the way. And I think sometimes it's, we hear things like non-adherence, non-compliance. Why is
Non-compliance.
and why is this happening? And why isn't this patient showing up? And they've been a no-show, or they're coming to the emergency room. And, I think we really have to listen more closely to understand what's getting in the way so we can provide that better, more person-centered, patient-centered care So I think that would be the little nugget I'd like
Great
to say
advice.
is to really meet people where they are and always start by listening. And I think that could apply not just to rural health professionals, but also
everywhere.
Legislators everywhere, right? It's
Preach
just
it.
like,
Amen.
Yeah,
That's right.
listening.
There's a great opportunity just to stop and listen.
Yes.
When we meet people where they are, we tend to connect more. We tend to humanize. We tend to find that we can build connections. But when we go in with just preconceived ideas and avoidance, it never works. So great advice. Alana, thank you so much for joining us today on Rural Health Today. It's been great to learn a lot more than we've ever known about the work that's being done by you and your organization and about MS in general. And certainly a lot of opportunity for awareness in our rural communities. So thank you so much for joining us today.
Thank you so much for having me, JJ.
Absolutely. And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of affairs in rural health every Monday, wherever you get your podcast. And don't forget to check out our latest updates and resources for Rural Health Today at ruralhealthtoday.com. And make sure you've subscribed to the show so you never miss an episode. Until next time, remember, Rural Health Strong.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.